Children's Mental Health Week is an essential observance dedicated to raising awareness about the mental health and well-being of children and young people. Recognized globally, this week-long event emphasizes the importance of early intervention, support, and understanding to promote positive mental health outcomes for children and adolescents. The significance of Children's Mental Health Week lies in addressing the growing concerns and challenges faced by young individuals in today's complex and rapidly changing world. From academic pressures and social media influences to family dynamics and societal expectations, children and young people encounter various stressors that can impact their mental health and well-being. By focusing on this critical issue, Children's Mental Health Week aims to foster awareness, reduce stigma, and encourage conversations about mental health among children, families, educators, healthcare professionals, and policymakers. Historical background and evolution. The recognition of Children's Mental Health Week can be traced back to efforts by mental health advocates, organizations, and stakeholders who recognized the need for a dedicated initiative to address the unique mental health needs of children and young people. Over the years, the observance has gained momentum, with increased participation from schools, communities, and institutions worldwide. Themes and objectives. Each year, Children's Mental Health Week focuses on specific themes and objectives to guide activities, campaigns, and initiatives. These themes often reflect current trends, research findings, and emerging issues related to children's mental health. For example, themes may encompass topics such as resilience building, emotional regulation, bullying prevention, digital well-being, mindfulness practices, and support for vulnerable populations. The objectives of Children's Mental Health Week typically include raising awareness, educating the public about the importance of children's mental health and well-being, including the prevalence, signs, and symptoms of common mental health conditions such as anxiety, depression, ADHD, and behavioral disorders. Reducing stigma, challenging stereotypes, misconceptions, and stigma associated with mental health issues among children and adolescents. Promoting empathy, understanding, and acceptance to create supportive environments in schools, communities, and homes. Promoting early intervention, highlighting the significance of early identification, assessment, and intervention strategies to address mental health concerns effectively. Emphasizing the role of parents, educators, healthcare providers, and other stakeholders in recognizing and supporting children's mental health needs. Empowering children and families, providing children, families, and caregivers with resources, tools, and strategies to enhance resilience, coping skills, and positive mental health outcomes. Encouraging open communication, active listening, and supportive relationships within families and communities. Advocacy and policy reform, advocating for policy changes, funding initiatives, and systemic reforms to improve access to mental health services, resources, and supports for children and young people. Collaborating with policymakers, legislators, and stakeholders to prioritize children's mental health on local, national, and global agendas. Activities and initiatives. During Children's Mental Health Week, various activities and initiatives are organized to engage children, families, schools, and communities actively. These may include school-based programs, organizing assemblies, workshops, and classroom activities focused on mental health education, skill building, and awareness raising. Incorporating curricular and extracurricular activities that promote emotional intelligence, social skills, and positive peer relationships. Community events, hosting community forums, seminars, and outreach programs to educate parents, caregivers, and community members about children's mental health issues. Collaborating with local organizations, healthcare providers, and agencies to provide information, resources, and support services. Digital campaigns, leveraging social media platforms, websites, and digital technologies to disseminate information, share personal stories, and engage audiences in conversations about children's mental health. Creating multimedia content, interactive resources, and online forums to reach diverse audiences and facilitate dialogue. Professional development, offering training sessions, workshops, and conferences for educators, healthcare professionals, and youth workers. Enhancing their knowledge, skills, and competencies in addressing children's mental health needs effectively. Providing evidence-based practices, interventions, and strategies to support positive outcomes for children and young people. Parent and caregiver support, establishing support groups, helplines, and resources for parents, caregivers, and families navigating children's mental health challenges. Providing guidance, encouragement, and practical tools to promote resilience, self-care, and well-being within families. Challenges and opportunities. Despite the growing recognition and efforts to address children's mental health, various challenges persist. These include stigma and discrimination. The ongoing stigma associated with mental health issues can hinder awareness, acceptance, and access to support services for children and families. Addressing stigma requires concerted efforts from individuals, communities, institutions, and policymakers to promote understanding, empathy, and inclusivity. Access to services. Many children and families face barriers to accessing timely, affordable, and quality mental health services and supports. Addressing systemic issues, funding constraints, workforce shortages, and geographic disparities is essential to ensure equitable access to care for all children and young people. Holistic approach, recognizing the interconnectedness of physical, emotional, social, and environmental factors influencing children's mental health. Adopting a holistic approach that considers the diverse needs, experiences, and contexts of children and families is crucial to developing comprehensive, integrated, and person-centered interventions and supports. Despite these challenges, Children's Mental Health Week presents opportunities to foster collaboration, innovation, and advocacy in advancing children's mental health and well-being. By raising awareness, reducing stigma, promoting early intervention, empowering children and families, and advocating for systemic reforms, we can create supportive environments and communities where all children and young people can thrive. Conclusion. In summary, Children's Mental Health Week is a vital observance that highlights the importance of prioritizing children's mental health and well-being. By raising awareness, reducing stigma, promoting early intervention, and fostering collaboration among stakeholders, we can create supportive environments, resources, and services to address the unique needs of children and young people. As we continue to navigate the complexities of today's world, let us recognize the value of investing in children's mental health and ensuring that every child has the opportunity to grow, learn, and thrive in nurturing and supportive communities.